Thank you, Mr. Chairman, Madam Director. It's great to see you. I just heard Senator Marshall mention that that coming down on unemployment was all COVID. Isn't it a fact that around the time the president was sworn in, economists across the board were projecting much deeper levels of unemployment and for longer than we've experienced?
Senator, it took us nearly 5 years to get through the economic scarring of the Great Recession many of us lived through in 2009. So it was not a surety that we could come out of this pandemic with the strength that this economy has. And the president deserves strong credit. Thank you all for the American Rescue Plan. And people should not assume that that was a given, that the president could lead us so strongly out of a global pandemic.
I appreciate that. In fact, the Nonpartisan Congressional Budget Office projected that unemployment rates in the United States would last at a higher level for a lot longer. And as you say, because of the American Rescue Plan, we were able not only to address the COVID health crisis, but also address the economic fallout from that crisis. And unfortunately, we didn't have any help from any of our Republican colleagues in passing that. Let me just take a moment to thank you and the President for some of the important priorities in the budget. For Maryland, for example, continuing robust cleanup of the Chesapeake Bay, important support for NASA Goddard, which is a national asset, and a number of other priorities, including the National Institutes of Health, which of course benefit all Americans who have experienced health issues, which is just about every American family. So I want to thank you for some of those priorities. I do want to also commend you on dealing with tax expenditures, right? Tax expenditures are tax breaks where special interests don't have to sort of pay the same rate or under the same rules as everybody else because they got a carve out. It's essentially a handout through the tax system by creating special exceptions. So I appreciate the fact that the President's budget goes after some of these tax breaks, like corporate jets, like a lot of the big tax breaks for the oil and gas industry. Could you just talk about why it's important that we have a fair tax system that doesn't include carve-outs for special interests, and how that also helps not only provide important investments for working families, but also contributes to reducing the deficit?
Look at our Medicare proposal, Senator. By asking the wealthiest in this country to pay 1.2% more, by closing loopholes for people who have found ways not to pay Medicare taxes, we can save the Medicare program indefinitely. That is a small example, if you extrapolate to lots of different policies here, of what we can do. We can do more for middle class and working families. 1.2% for Medicare. You know, this isn't, you heard the president say, he's not trying to keep rich people from being rich and maybe having 2 boats instead of 3 by helping all Americans. And it goes on in-kind contributions. All of those things ensures that we pay for every investment. We make sure NIH has the resources they need. We make sure we have a child care system that is actually affordable. I pay child care every month. I don't know how families do it. I really don't, other than leaving their children in places where they're nervous every day to leave their kids. The richest nation in the world, we can do better. And we can pay for that. We can pay for that. We can help families by having a fair tax code.
I appreciate that, Madam Director, and I would also point out when it comes to Medicare, in addition to providing long-term stability and solvency through the mechanism you talked about, the President also said he wants to announce and will announce or wants to announce additional drugs that would be subject to negotiating so that we can both reduce costs for Medicare and extend its life and lower costs for seniors on Medicare. He also said, and I fully support the idea of trying to bring down those prescription drug costs for everybody. We did it for insulin on Medicare. We're trying to do it for everybody. In my remaining time in the Social Security Administration, I was pleased to see the increase in resources for Social Security Administration, which of course is based in Maryland. But can you just talk for a minute about how stressed it is, how outdated the technology is? This is something we should all support. We're not talking about the benefit side, we're talking about the administration side.
But we are talking about benefits.
It impacts the benefits.
If we want Americans to access their benefits,
Yeah.
We cannot continue to starve the Social Security Administration of resources, and that is what has happened. We're asking for a 9% increase. We've asked for an increase every year, and we are frankly begging for your support to help fund this agency. We cannot starve an agency of funding and then question why phone calls aren't getting answered. Now, on our side, we have finally a new administrator in place, and thank you all for making that happen. It's incredibly important to have confirmed leadership there to make sure management practices are up to date. But there's only so much more you can do with a lot less. And they have been starved of resources for far too long, and people should have their phone calls answered. And we're doing all we can with what we have at Social Security, but we need the resources.
Thank you, Mr. Chairman. I would just observe that the Social Security Administration is serving 50% more people than it was decades ago with less staff than were there.
Senator, you should see the graph the administrator has. Benefits, people needing benefits, and staffing. They cross each other in a very troubling manner, and it's just going to get worse and worse.
Thank you. Thank you, Mr.
Thanks, Senator Bernard.